I'd rather try Lusedra in procedures other than colonoscopy and bronchoscopy. Can I do that?
My colonoscopy procedures only last about 15 minutes. Why would I use Lusedra for these procedures?
What's the appropriate Lusedra dose for a patient undergoing a minor procedure?
Would you like to observe the use of Lusedra in a minor procedure?
What types of minor procedures would be appropriate for Lusedra?
Would Lusedra be appropriate for use in a bunionectomy?
It's challenging, isn't it? Here's an anesthesiologist, or CRNA, who seems really interested in Lusedra. The presentation is going well, you're close to asking for the business, and then he hits you with a question you're not sure how to answer. We want to help you respond to these kinds of questions so you can address your customers' needs. That's why we've put together this video. We've put together a cross-functional team of ASI experts representing our marketing, sales, medical, legal, and regulatory departments to help us develop a management plan for addressing these challenging scenarios. With their help, we've created a Lusedra response statement for you to use when faced with off-label questions. But before we share our directions for managing these questions, we want you to understand the story behind the Lusedra story. Then, we'll face those physician questions again and show you how to answer them so that you can get back to selling in a compliant manner. So, let's start with why the Lusedra clinical program focused only on colonoscopy and bronchoscopy. Lusedra was originally studied by Guilford Pharmaceuticals for use mostly by proceduralists, such as gastroenterologists and pulmonologists, not anesthesiologists. Since colonoscopy and bronchoscopy are two of the most common procedures performed by proceduralists, the pivotal clinical trial program of randomized, double-blind, well-controlled studies focused on them. To ensure that there was sufficient safety information with Lusedra, the company also conducted safety-only studies that were not blinded or controlled in minor procedures. The FDA approved the use of Lusedra based on their review of our efficacy and safety data in bronchoscopy and colonoscopy, and additional safety data in minor procedures. They then gave us an indication for max sedation in adult patients undergoing diagnostic or therapeutic procedures, and required that we include the following statement in the Lusedra prescribing information. A person trained in the administration of general anesthesia and not involved in the conduct of the diagnostic or therapeutic procedure should manage treatment of patients with Lusedra. Why is that a challenge? Because anesthesiologists and CRNAs are often interested in where else they can use Lusedra in addition to colonoscopy and bronchoscopy. As I said earlier, the studies in other minor procedures were designed to demonstrate safety only. That's why we can't make efficacy claims about the use of Lusedra in specific minor procedures. Now that we've explained the challenge we face, let's focus on how we can manage it. So what should you say when a physician asks about the efficacy of Lusedra in minor procedures or the appropriate dose in such procedures? You should reply with the appropriate portion of what we call our Lusedra response statement, which goes like this. Lusedra is indicated for max sedation in adult patients undergoing diagnostic or therapeutic procedures. The efficacy studies for Lusedra were conducted in colonoscopy and bronchoscopy procedures. To evaluate the safety of Lusedra, additional studies were conducted in minor procedures. I can discuss efficacy results in bronchoscopy and colonoscopy and discuss safety results in minor procedures, but I am unable to discuss the use of Lusedra in specific minor procedures. If physicians ask for additional off-label information, refer them to medical services by using the Focus system, or have them call 888-422-4743, or have them complete a form requesting a response from a medical science liaison. Additionally, we want to remind you of the following do's and don'ts, and specifically of our policy on drug promotion when answering off-label questions. Do stay on-label. That means if it's in the PI, you can say it. Do put your claims in context. If you offer study results, describe the study first. And do provide fair balance. Note the adverse events and warnings that are pertinent to what you're discussing. And always refer off-label questions to medical services. Don't talk about the efficacy of Lusedra other than in colonoscopy and bronchoscopy. Don't discuss minor procedures except in the context of safety. Never speculate on comparisons between Lusedra and other agents or discuss off-label information. Now that we've reviewed what's behind the Lusedra story and some do's and don'ts, let's go back to some of those challenging questions you've been hearing in the field. The key to each response is to stay on label using our Lusedra response statement and, whenever necessary, refer physicians to our medical services department for further medical information.
I'd rather try Lusedra in procedures other than colonoscopy and bronchoscopy. Can I do that?
Lusedra is indicated for max sedation in adult patients undergoing diagnostic or therapeutic procedures. The efficacy studies for Lusedra were conducted in colonoscopy and bronchoscopy procedures. To evaluate the safety of Lusedra, additional studies were conducted in minor procedures. I can discuss efficacy results in bronchoscopy and colonoscopy and discuss safety results in minor procedures, but I am unable to discuss the use of Lusedra in specific minor procedures.
How can I find out more about the use of Lusedra in minor procedures?
I can have you fill out this form to request further medical information.
That'll be great.
My colonoscopy procedures only last about 15 minutes. Why would I use Lusedra for these procedures?
Colonoscopies can vary in length, requiring up to 60 minutes in some patient types. In Lusedra studies, the median length of colonoscopy procedures was 11 minutes, and the median time to sedation was 8 minutes. Are there patients who would benefit from the more gradual onset of action of Lusedra?
What's the appropriate Lusedra dose for a patient undergoing a minor procedure?
Doctor, the dosing for Lusedra was determined using colonoscopy and bronchoscopy procedures. For ease of determining the appropriate dose in those procedures, we've created this dosing guide. Let's walk through it together.
Would you like to observe the use of Lusedra in a minor procedure?
Thanks for the invitation, doctor, but I can't. If there's an opportunity to observe a colonoscopy or bronchoscopy, I'd love to.
What types of minor procedures would be appropriate for Lusedra?
Lusedra is indicated for max sedation in adult patients undergoing diagnostic or therapeutic procedures. The efficacy studies for Lusedra were conducted in colonoscopy and bronchoscopy procedures. To evaluate the safety of Lusedra, additional studies were conducted in minor procedures. I can discuss efficacy results in bronchoscopy and colonoscopy and discuss safety results in minor procedures, but I am unable to discuss the use of Lusedra in specific minor procedures.
Then how can I find out more about the use of Lusedra in minor procedures?
Here's the number of our medical services department. They'd be happy to answer your questions.
Great, thanks.
Okay, in the meantime, let's take a closer look at the efficacy results from our bronchoscopy and colonoscopy studies.
Would Lusedra be appropriate for use in a bunionectomy?
I can't discuss that, doctor, as that information is not within our approved package insert. However, I can have you fill out this form, and a response can be provided from medical services or one of our medical science liaisons based on all available information.